In our first community conversation, we're joined by Dr. Robert Fuller, maternal-fetal medicine specialist for UVA Health. He's sitting down with Aaron.
Dr. Fuller, thank you for coming in today.
Thank you for having me.
You're very welcome. So let's talk about birth defects. What are some of the most common birth defects?
You know, that's a great question. Most people don't realize, but the most common birth defect is a heart defect. About 1% of all babies that are born will have a heart defect. Some of those are major heart defects that require emergency surgery and sometimes many surgeries over the course of a lifetime. But some are minor and just need to be followed and don't require any treatment.
And what are the major risk factors for birth defects?
Sure. So the most common modifiable risk factors would be medication exposures. Sometimes medications that people are taking in a very stable way for a chronic condition aren't suitable for pregnancy, and medications should be switched. But some birth defects are just random, and there aren't particular risk factors, but they occur in a percentage of just healthy people.
And are there any things that mothers could do before or during pregnancy to reduce the risk of birth defects?
So that's a great question. The most common answer to that would be to just take care of one's health. Being a healthy individual will give the person the best chance of having a healthy pregnancy. That includes nutrition, being current with their chronic medical condition management. Also, if you're a vaccinator, then being current with your vaccines would be beneficial. All of these are simple steps. Then if people have habits, some habits have risk factors for birth defects, such as tobacco smoking or alcohol use or illicit and recreational drugs. And sometimes just eliminating those substances for the time of being pregnant is enough to reduce your risk.
And then what treatment and care options are available?
Well, we want a mom to be prepared for pregnancy. So prior to pregnancy, we would advise individuals who are trying to become pregnant to seek a little bit of medical care and advice, more than just the internet, to be able to determine how they can be healthiest and reduce their risks. Sometimes there aren't many additional steps to be done, and a person will become pregnant or become pregnant in an unplanned way. So our next step there is to have prenatal care early. Sometimes risk factors can be identified and modified early in pregnancy that can have a big impact during the pregnancy itself. During the pregnancy, we recommend good prenatal care, which would include ultrasound evaluations, doctor evaluations, and so forth. And by following good medical advice, we can reduce the risk of a baby developing a birth defect.
That's wonderful. Glad to hear that there are treatment and care options available.
Thank you.
Well, thank you so much, Dr. Fuller, for coming in. It was great having you here.
Thank you. It's my pleasure, and thank you for the opportunity.
Anytime. Thank you so much.
Thank you.
Steve?